virtual meeting of the Oregon School Law Advisory Committee. Welcome to our guests and our committee members, as well as to our staff. We're very grateful for your time. My name's Mimi Luther, and I am sitting in today for Erin Dunn, who normally chairs this meeting. And I'm going to go through a couple of housekeeping steps before we turn it over to Stacy. So this meeting is being recorded. If you're at all uncomfortable with that in any way, feel free to disconnect and you can request minutes of the meeting. From our office, there is no public comment session during today's agenda. We sent out a request for public comment through our public meeting notice system, and we have shared all of the comments that we received with all of the committee members. Thank you for those of you who sent us comments. We ask that folks who are not members of the committee, for instance, if you're a general public or the press, that you not attempt to comment during the meeting, either through the voice process or through our chat box. While we appreciate your presence and your interest, we will always welcome further input from you. Feel free to email us and we will get back to you. Everybody keep your phones muted unless you're getting ready to speak. And again, that would just be to staff and committee members. And that is my housekeeping. I'm going to turn it over to Stacy to do roll call and launch us into our first presentation.
Okay, thank you, Mimi. Can you hear me okay?
Yep.
All right, so I'm going to go through roll call of our members. We do have a couple of members who are connecting by phone and so are unable to see the chat window. And part of our agenda today involves a group discussion from the group. So we'd like to conduct that orally as much as possible. And so through the roll call, I'm going to ask you when I call your name to go ahead and unmute your line and say hello and what organization you're with. And that way we'll be able to conduct an audio check as well at the same time. Okay. Morgan Allen. And the slide on the screen shows where you can unmute. If you don't see that bar at the bottom of your screen, if you move your mouse, if you're on a computer, that bar should appear, or if you touch the screen on your phone, that bar should appear and you'll be able to unmute your line. Okay, I think Morgan is not with us today. Mark Bajorek.
Here.
And Mark, if you could say
with Portland State University, but it looks like they just added a patient, so I might be popping off in about 5 minutes.
All right, thanks, Mark. Kim Bartholomew.
Hello, Beaverton School District nurse representing Oregon School Nurses Association.
Thanks, Kim. Kate Blair. Kate, I believe I saw you on the webinar. If you can unmute your line and say hello. And if not, we will come back to you. Judy Booker. Corinna Brower.
Hello, this is Corinna Brower. I'm here. I'm the State School Nurse Consultant at the Public Health Division of Oregon Health Authority.
Hi, Corinna. Paul C. Slack.
Hello, everybody. I'm Paul C. Slack, Medical Director for Communicable Disease and Immunizations here at the Oregon Health Authority's Public Health Division.
Thanks, Paul. Donalda Dodson.
Donalda Dodson, Oregon Child Development Coalition.
Thanks, Donalda.
Hi, good. Yeah.
Richard Donovan.
Good afternoon, Richard Donovan on behalf of the Oregon School Boards Association.
Thank you. Jim Green.
He's not coming, but he also works the Oregon School Boards Association.
Thanks. Matthew Green.
This is Matthew Green, Government Relations with Oregon Health Authority.
Thanks. Sasha Grenier. Dana Harganani. Anne Loeffler.
Hello, I'm Ann Loeffler. I'm a pediatric infectious disease physician and the new deputy health officer for Multnomah County. I am taking Dr. Jen Bine's place, and I'm also representing the Tri-County health officers. Thanks for having me.
Thank you. Suzanne McClintock.
Hi, I'm here. I'm a pediatrician at Childhood Health Associates in Salem.
Mallory Metzger.
Here, I'm with the immunization program at the Oregon Health Authority.
Anne Ochi.
Hello, I'm Ann Ochi. I'm a nurse supervisor with Multnomah Education School Service District, School Health Services, Immunization Program Manager.
Thanks, Anne. Mark Siegel.
Hi, Mark Siegel, Oregon Federation of Independent Schools.
Welcome, Mark.
Thank
Jamie
you.
Smith.
Jamie Smith, I'm the coordinator of school health services at Multnomah ESD.
Thanks. Sarah Stearns.
Sarah Stearns at Oregon Association for the Education of Young Children.
Thanks, Sarah. Abby Strom.
Hi, I'm Abby Strom. I'm with the Early Learning Division Office of Child Care, and I'm filling in for Catherine Miller.
Thanks for being with us today, Abby. Anne Van Kuren.
I'm here. I'm with the immunization program, and I'm taking notes for the meeting today.
Thanks, Anne. Erin Williams. And Colette Young. All right, and I'm going to come back to Kate Blair to see if your audio is working. And it looks like we're still not able to hear you, Kate. All right, and are there any committee members who I missed?
I think Sasha entered the meeting. Sasha, are you there?
Hi, everyone. Yeah. Oh, gosh. Sorry, I'm having connectivity issues. I'm Sasha Grenier from the Oregon Department of Education, School Health and Sexuality Education Specialist.
Thanks, Sasha. All right, and Colette Young looks like may have joined. Colette, if you're there, if you want to unmute and do an audio check with us.
Can you hear me? No.
Yes, and let us know your position. Colette is the Center Administrator for the Center for Public Health Practice at the Oregon Health Authority. All right, okay, so I'm gonna go ahead and thank everybody. Thank you for the members, the guests, and the public for attending this meeting. And we're going to start off with sharing some immunization data from last school year and data from this spring and summer during the time of COVID. And then we're going to move on to a section where we want to get some feedback from you about what's different this year in schools, childcares, and colleges. Hear the questions that you're getting about immunization requirements and listen to the ideas that you have. So I'm going to go ahead and start out with the presentation of some data. Okay, so starting with last school year, the 2019-2020 school year, Oregon had over 4 million people, and 700,000 of which were children in school and childcare that were covered by Oregon's immunization laws. About 3,600 programs, including public and private schools, certified childcares, Head Starts, and preschools are in Oregon where immunizations are required. And the process in Oregon involves every child's record being checked by the school every year. And this helps ensure that each kid can be updated on immunizations if they're due. And it helps protect individual kids in our schools and our school communities from outbreaks. So last school year, Oregon has a process where the third Wednesday in February is what we call Exclusion Day. And it's the deadline by which all kids' records must be updated, either with documentation of immunization or exemption. And notice goes out to kids who are missing this documentation each year. And last school year, 21,596 kids were notified of missing documentation of immunization or exemption, which is about 3% of kids. And 3,268 kids were excluded on the February exclusion day, which is about 1 in every 200 kids. And in order to get back into school or childcare, child must have documentation on file of either immunization or exemption. So as soon as they bring in that paperwork, they're allowed right back into school or childcare. So I wanted to share with you some statewide data that we collected that shows this is a large process involving these 700,000 kids and checking their records each year. It's a lot of work by schools, by parents and guardians to get their children immunized and bring in the documentation of immunization or exemption. And by our local health departments who are collecting all of this information. And so what is the result of this process? Well, this is a graph showing the percent of kids with school or what we call children's facility, that's childcares, preschools, and Head Starts, that has all the required vaccines. So yellow is the children's facility and green are school-age kids in grades K through 12. And it's the percent of kids who are complete on each of those different school required vaccines. And between 94 and 96% of kids, after we have this notification process every year and that deadline in February, provide documentation of up-to-date immunizations. So statewide, we have very high immunization rates for all these different vaccines in our schools and our child care facilities. For kids who are not up to date on those vaccines, there are two different exemptions in Oregon: a medical exemption, which is based on a contraindication or precaution to immunization. And that's a very small percentage of kids have a medical exemption. The majority of kids with an exemption in Oregon have what's called a non-medical exemption. And you can see those percentage there. In our K through 12 population, we're looking at about 5.9% of kids have an exemption to one or more of the required vaccines, and slightly lower than that in the children's facility population. And then we also specifically track non-medical exemption rates at school entry. So here's a graph of school entry kindergarten exemption rates over time, going back to the 1980s. So in the 1980s, for the first decade or so that we were tracking this, non-medical exemption rates hovered at just above 1%. Then around 1999, the non-medical exemption rates started to increase and continued increasing up to 7% in around 2014. That was the year that the Oregon legislature passed a law and the governor signed it into a law to require a new process for claiming an exemption. The old process was just that a parent signed a form in order to claim an exemption. The new process requires parents to get a little bit of education, either from watching an online video or from a healthcare practitioner, about the benefits and risks of immunizations prior to claiming that exemption. The first year after that law was implemented, we did see a decrease in the kindergarten non-medical exemption rate. And then in the next couple of years, we saw that exemption rate increase again until finally last year, it leveled out at about 7.5%. And then this this school year that just finished up, we actually saw a decrease in Oregon's kindergarten non-medical exemption rate again for the first time since 2015. And so that went down to 6.9% of kids with an exemption to one or more of the required vaccines in kindergarten. Okay, so that was statewide data that I shared with you. We see, while our immunization rates are very high and our exemption rates are relatively low compared to our immunization rates statewide, we do see a lot of variability county to county. So I wanted to share with you some countywide data. This is going to be a series of maps showing school entry non-medical exemptions for the past 2 decades. So starting in 2000, when we started to see that increase in exemption rates. So on this map, the darker the blue color, the higher the exemption rate. And I do want to point out in this first year of this map, you can see Wallowa County in the northeast corner of the state has a high exemption rate. And one of the reasons for that is they have a low population. So only a few kids can really change their exemption rate. And you will see that among especially our low population Eastern Oregon counties, that their exemption rates fluctuate quite a bit because of small populations and a few kids making a real impact on that exemption rate. But we sometimes have people say that exemptions are an issue only in certain parts of the state. And I wanted to give you a picture of how exemption rates have changed throughout the state over time. So this is starting in 2000, 2001. This is 2001, 2002, and continuing forward in the years. And remember, the darker the blue color, the higher the exemption rate. So here we are at 2010, 2014, and this was the peak, the year, the last year of data just before the new non-medical exemption process was implemented. Then in 2015, we saw a decrease in the non-medical exemption rates before it increased again in 2015-16, 2017, 2018, leveled off in 2019, and then the decrease finally that we saw this year. So you can see that the picture of non-medical exemptions has changed throughout the state in every county and become more prominent in every county over time. And then finally, I wanted to zoom in a little bit closer and look at school level data because when we're thinking about the risk of, say, a disease outbreak, what we're concerned about is an individual school community. So for example, I'm going to show a graph. So this graph here is actually a bar graph, and it's all 1,674 schools in Oregon with at least 10 students, and the percent of kids in each of that school that's complete for measles containing vaccine. So these are 1,600 skinny little bars that show the percent of kids complete for measles. And the median here is 96%. So that means that in half the schools in Oregon, more than 96% of kids are fully vaccinated against measles. And in half the schools, fewer than 96% of kids are fully vaccinated against measles. Now I put up a line in yellow here, which is the herd immunity threshold. So if you're a school, you want your green bar to reach above that line, because we would expect if a case of measles came into your school and more than 93% of your kids were fully vaccinated, it would be less likely to turn into an outbreak. On the other hand, if fewer than 93% of kids are vaccinated against measles in particular, it's more likely to turn into an outbreak in your school if a case of measles came in. So 75% of schools in Oregon reach herd immunity for measles specifically, and this varies for each of the different vaccines. This is just an example with measles, which means that 25%, 1 in 4 schools in Oregon, if a case of measles came into that school, we would be worried that there's not enough protection and it would turn into an outbreak in that school. So if you want to see the immunization and exemption rates for individual schools in your community and your neighborhood, the Oregon Health Authority has an interactive map with this information on it. You can click on those little red circles and you can zoom on this map and find a school in your neighborhood. This is the K through 12 map. On that same website, there's also a child care age map, so you can see individual child care immunization rates as well. All right, moving on here to the spring and summer of 2020 during the COVID era. So how has COVID impacted immunizations? Well, an unintended consequence of controlling COVID-19 is a reduction in access to care. We did a survey of Oregon Vaccines for Children clinical providers in April and found that most clinical practices initially limited access to routine care, but continued to see infants. And this was in line with guidance from the CDC and the American Academy of Pediatrics at that time. Some clinics actually had to shut down initially during the pandemic, and some had to stop immunizing. In addition to clinical factors, parents may be reluctant to bring in kids for non-urgent reasons. So how can we see how much of a mountain we have to climb? We know there was a reduction in access to immunization services. And so how we evaluate that is by looking at the Alert Immunization Information System, which is a registry of immunizations given in Oregon. And we compare 2019 versus 2020, the number of shots given. So we looked at the number of shots given for the diphtheria, tetanus, and pertussis, that's DTaP, given to infants. The MMR, that's measles, mumps, and rubella, given to 1-year-olds. And then in teens, we looked at the Tdap vaccine, which is tetanus, diphtheria, and pertussis, given at 9 to 13 years of age. And we looked at the HPV vaccine given to 9 to 13 years of age. We actually looked at more vaccines than this, but these are the ones I'm going to highlight for this presentation. All right, so this graph here looks at the number of immunizations given per month for the DTaP vaccine, comparing 2019 in blue and 2020 in orange. And what I want you to do on this graph is to look at each month and compare 2019 to 2020. So in January, we can see the blue bar and the orange bar are about the same height. So roughly the same number of immunizations of DTaP was given to this age group in 2019 versus 2020 in January. In February, we see those bars are once again of equal height. So same number of immunizations given in February 2019 versus February 2020. In March, that's when COVID hit. So we we could measure a decrease in the number of immunizations given to infants from 2019 to 2020. We saw that decrease continue in April and continue in May, before in June, we finally saw our 2020 rates pick back up to our 2019 rates, and almost the same level, just a little bit lower in July. Here's the measles, mumps, rubella vaccines given at a year of age. So once again, looking at 2019 versus 2020 each month. In January, pretty equal. In February, pretty equal. And then in March, we see that big drop off again of 2020 shots compared to 2019, continue into April, May, before finally in 2020 in June, we saw it pick back up again. And in July, pretty close to equivalent as well. So those are some early childhood shots. Now I want to move into shots that are given to adolescents. So this is the Tdap vaccine. It's the required vaccine at 7th grade. So if we look at January and February, once again, we see 2019 and 2020 being fairly equivalent. Just one thing to point out, in February, we always see an increase in the school required shots because of the annual exclusion day and families coming in to meet that exclusion day deadline in February. Then in March, we really saw a drop off in 2020 compared to 2019, and even more so in April and continuing into May. In June, we saw our 2020 rates pick back up again, but in July, our 2020 rates have not been equivalent to the 2019 rates, and July is when we often start seeing families coming in for back to school shots. And so we didn't see that with Tdap this year. And then finally, I wanted to wrap this up with HPV vaccine. Now, HPV is not required for school attendance in Oregon. But I did want to share that we see increases in February where HPV vaccine is given along with Tdap vaccine as it is recommended to be if a teen is due for both of those immunizations. So really our school required vaccines do help increase immunizations of all the different recommended vaccines. We saw a big decrease in HPV administration in March and April and May, just like we saw with Tdap, and then pick back up again in June, and we see that discrepancy again in July. So the future does look pretty hazy. We don't know exactly what to expect. We do have some strategies this year. We would like to provide early notification to families missing documentation of immunization or exemption. So schools often voluntarily notify families in the fall that their child is missing documentation of immunization or exemption, and they need to get that information in so they wouldn't be subject to the February exclusion time. And as early as possible as that notification can have, we'll let families get as much time as possible to get in because access to clinical services might be more limited this year. We want to be able to let families know where and how to get vaccines this year because getting vaccines may have changed. We used to see a lot of big clinics in February that were walk-in only, and we may see that shift this year to more vaccination by appointment throughout the year instead of walk-in clinics. We want to decrease that peak of immunizations that we see each February by spreading the demand throughout the fall to help make sure we don't have too much strain at any one time on our health care resources. We want to use school required vaccines as an opportunity to give all recommended vaccines, including influenza this fall and winter, because we may not see families as often accessing clinical care as we used to. So we need to be able to give all the vaccines that are recommended for a person at that time. And really, this school year, we're going to need everybody's help to make sure individuals can catch up on those vaccines that we saw that were missed during the spring and to keep our communities healthy. And I want to thank Steve Robeson and the Alert IIS team for help with the data. Okay, and at that point, I want to go ahead and ask Albert if there have been any questions from the advisory committee members come through the chat. And I also want to welcome committee members to go ahead and unmute if you have any questions and ask any questions that you have.
Yeah, one moment. I'm just checking our list here. There's some questions from non-committee members, but I'm just double checking here.
Stacy, do we have any data that shows that perhaps people went to other pharmacies, you know, the Costco pharmacy, CVS, any of those non-traditional doctor, nurse practitioner, PA type clinics to get any shots over that February, March, April time period?
Yeah, Kim, thanks for that question. We can look at those data. One thing that we do know from some of the information is that pharmacies were one of the practices that initially shut down to providing immunization services during the spring. My understanding is that pharmacies are back immunizing now. But I believe that was one of the contributing factors to seeing a decrease in the immunization rates along with other clinic types.
Okay, Stacy, no direct questions from any of the committee members yet.
All right, so committee members, please go ahead and if you have additional questions on the data, go ahead. I'll give you a minute to unmute your line.
Hi, Stacy. This is Richard from OSBA. So is the big takeaway that vaccines are down? Is that too much of a one sentence summary?
Vaccines are down, and it's going to require work from all of our partners to make sure that vaccination rates come back up again. So when we do have return to in-person learning, we want to make sure that schools are safe environments for kids, and we're not looking at a risk of increased vaccine preventable diseases.
Great, thanks.
All right, so the information that we provided was just sort of a primer. Like Richard said, vaccine rates are down. And Mallory is going to lead us through some discussion about what school immunizations may be looking like this year.
Hi, everyone. First, we're going to hear from Dr. Cieslak, just a little overview about why we do this work. So Dr. Cieslak, go for it.
Thanks. Well, I just want to thank all the members of the committee because this is really important work. Getting our kids immunized, you know, everybody knows that when you pack a lot of young, immunologically naive people together, you're likely to see pretty rapid disease spread. And so getting them vaccinated for school entry becomes particularly important. And as far as controlling the disease in general, it has really proved pivotal. You probably know that smallpox is the only disease that we've eradicated, but we really don't see any diphtheria, any rubella, any measles anymore unless it's imported from some other country. Because we've been able to maintain high immunization rates among our children. So the effect is really very important, and we're reluctant to see the progress lost because of several months of people being unable or afraid to go to the doctor and get their required vaccines. And in addition, as you know, because we're in this pandemic, we're all hoping to get a vaccine eventually so that we can shut down transmission of that particular disease. We've heard optimistic reports of vaccines being produced and maybe being available very soon. I would just caution everybody that there's a lot of work to be done before these vaccines can be verified as both safe enough and effective enough. And beyond that, until the supply is sufficient where we might even consider it for school entry. So the short-term goal is really to think about what are we going to do with the already well institutionalized vaccines among our school children during this particular school year. So I'll leave it at that and hand it back to you, Mallory.
Thank you. So as this year is got some real unique challenges, we at the state have been thinking a lot about how to prepare and realize we need input from all the stakeholders, and this was a really good opportunity to get folks in a Zoom room together to get your opinion. So I think the first place I want to start off is with the requirements around immunizations and distance learning. We're getting a lot of questions at the state, and I kind of want to hear what our other committee members are hearing, what questions they're getting, what things they're putting into place or thinking about or concerned about. So I'll stop there and say, let's talk about distance learning for now. So one way to start is, what questions are you hearing? I'm hearing a lot about, oh, Anne, you raised your hand. You can unmute.
I wasn't sure if I should just jump in or wait.
Go for it.
So I did get some calls from some parents this summer wondering if the current requirements for immunizations was going to hold due to the fact that kids were not going to be on site. And they're referring to that provision around that if they're not in the school more than 5 days, they don't need those immunizations. So that is one that's kind of looming out there. Our nurses and health assistants have now reported back, and overall, I am hearing from them that there are quite a few immunization records that have already been submitted to the Multnomah County schools. So that's encouraging. But there is wonder at the same time from some parents around, do I need to do this? Are we going to override it or amend it somehow so that we don't have to get this done?
Yes, we're getting those questions too. Others, what are you hearing about?
Mallory, this is Albert. There was a comment from Dr. Bajorek saying for PSU, students off campus are not needing to fill the measles requirement.
Mm-hmm.
Exactly. We've just pushed that out. Hopefully, we right now have a hybrid model with probably about 96% of the students doing just remote work. But for the students that are going to be on campus, they're still required to have that in place.
Corinna, I see you raised your hand.
I'd say I'm hearing from school nurses themselves, and I'd second what Anne just commented. We are getting a number of questions about whether or not access to remote learning would be shut off if students weren't vaccinated, and hearing both sides of the equation, that on the one hand, we're working really hard to connect students to their education. So there's a little bit of sadness considering that we would cut them off, and at the same time, fully understanding the importance of those vaccinations and how even knowing flu vaccine isn't a required one, how important those vaccines are to reducing burden on the healthcare system, and how we can get that message out and be connecting at the same time. So I would, in thinking about distance learning specifically, if there are resources from the state, I think that's part of the question that was coming in, is how can we reach out to families and connect them to easier ways to get those vaccines.
Consistent messaging along with that, Corinna. We're hearing from some sources that we're not going to be required if they're doing CDL, and then other sources will tell you no, that there is the requirement. So we need a consistent message that we can spread to teachers, administrators, and families especially.
Absolutely. We don't want people getting different messages on that front.
And I would just add too, there's definitely a fear in my mind if we don't return until January, let's say, that obviously there's not time between then and exclusion day to address the gaps that Stacy pointed out. So I agree with your advice that we all need to work together to try to figure that out, try to get this addressed much earlier than after the turn of the year, to try to make sure that we don't exclude kids when we maybe are just getting them back on site. So.
And Jamie, to that, I would say, yes, let's do that now, because oftentimes the ones we exclude are generally the most marginalized kids. So we definitely need to work with them now.
True. There's a high correlation between kids who are chronically absent and those that wind up getting excluded. So big concern there. The other thing that we're hearing is that right now the student health centers are not fully open. There's a limited number here in Multnomah County that are going to be available, and they're only going to be available to provide immunization to those students who are already established as clients. So there's, in that space too, limited availability to provide support, at least at this time.
Interesting. Hadn't heard that yet.
This is Sarah with Oregon Association for the Education of Young Children. And can you hear me? Yes. Yeah, what I am getting, what I'm hearing from a lot of parents is they're not feeling that pressure to get their children immunized quickly because they're not, they're at home for the next few months anyhow. And it made me think about when the slide was up that Stacy put up about the preventable measures or the moving forward. I want to make sure that we bring in the child care, the home providers and the directors, that they'll need to be on board with getting that messaging out to parents that it's still really important to get immunized even if your child is still at home, because at some point they will be going back to school. So I think making sure like the early learning division or we bring them in that messaging.
So one question I have for Albert, did you have?
Oh, I'm not sure how to say her name. Suzanne Stern or I'm not saying it right.
Sarah Stearns.
Sarah Stearns.
Yes.
Did you no, I'm sorry. Someone else right above you made a comment saying in Salem at their practice, the only question they've been getting is about when flu shots will happen. I just want to make sure that got into the conversation.
That was me. Sorry. I muted and figured it out. But yeah, and we did definitely see a decrease in visits during those same months that you saw a decrease in the immunization rate. But interestingly, we're still seeing a decrease in number of visits. It's like for our practice, probably 60 to 70% of our usual volume at this time of year. But the well child visits have not dropped off. So that's encouraging that at least people are bringing their kids in for those visits and getting their shots. And most of our questions, different than you all here, are just like when we're gonna be able to give flu shots.
So a question that we were wondering, when we were talking is, what are your thoughts? Do you think that if school is distance learning through exclusion day, the third Wednesday in February, is there a possibility that it could go in person after that? Do you think, you know, thinking about options and maybe pushing exclusion day back or something like that, would that, you know, deal with that confusion around what if the 5 days happens after February? Or is it likely that if they're not in school by mid-February, they're not going to be in school? Any insight into that?
So this is Richard from OSBA, and I would say I think it might make sense to consider the possibility that has some real geographic difference. A lot of my members across the state are really looking at the county level and are pushing to open up fully as soon as possible. That's ambitious right now, and they're prioritizing safety. But some of my kind of smaller, more rural districts are talking about distance learning for weeks, as opposed to some of my more kind of metro area districts that are really thinking it's going to be all year. And so I think there's going to be a wide variety even as soon as this winter.
I would second that, and I'd also like to emphasize that while most students are remote right now, most districts that I'm hearing from, there's some amount of in-person learning happening, limited in-person instruction or K-3 or in some places small sports and that sort of thing. So there is in-person happening consistently or constantly, even if the majority of students are still out. And I would be concerned in the spring about graduations. So even if things are distance, if celebrations start happening and bringing large groups together again.
Hi everyone, this is Sasha Grenier from ODE. I am joining this from like three different devices.
Okay, one of them's muted. Go for it, Sasha. Can you go now?
Well, she said she's gonna write it in the chat.
Okay, great.
So just give her a sec.
Okay, Albert, you'll read that one. Sasha?
Yeah, I'll read it out when it comes.
Thanks. Any other thoughts about that February exclusion day and whether there would be a risk or benefit of pushing exclusion day back or anything around that topic?
I would just be concerned with the confusion piece. I think we're already throwing a lot of different stuff at families. You know, we're already struggling with different exclusion criteria for communicable disease and just, you know, like somebody mentioned earlier, just the messaging piece. So I would be concerned of changing dates this year and what the ripple effect might be in future years if we confuse parents and all of a sudden people think there's different exclusion dates and that type of thing. So that would just be maybe a consideration to think about, of trying to keep things as consistent as possible in an inconsistent world in an unusual time. So.
And I also agree with that in terms of like even reporting for childcare facilities, center directors, all of that. There's so much changing in our world that being consistent would be, I think, appreciated. At least one thing not changing.
And Sasha just did make her comment here in the chat. It says, this has been a real geographic difference. Each school district has to plan for every scenario in distance and in person. So in theory, districts will be learning in person 1 week and transition to CDL a few weeks later.
Thanks, Sasha and Albert. Yeah. Yeah, so the mix between consistent messaging needed and things being really hectic and always changing is what I'm hearing, is that if we can have consistent messaging and keep things as as stable as possible, that's helpful.
So this is Richard from OSBA again, and I would ask, do we have any idea about the numbers of students that we're talking about? I mean, we have all this great data that goes down to the county level, and you can demonstrate differences between this year and last year in various immunizations. So can we project how many hundreds or thousands of students we're talking about? Because I think the scope of the problem will draw attention to it.
Any thoughts, Stacy, on that one?
Yeah, I definitely think it's possible to do a little bit more of a granular dive to make some estimates looking at last year's numbers versus this year's numbers. I think another really great source of information are the school student information systems themselves. I know, Anne, you do a lot of work, and Anne Ochi, you do a lot of work in looking at the data, for example, in Multnomah Education Service District at different parts of the year to sort of see where you are and immunization need, and encouraging schools to use those tools if they do have a student information system. That most of our public schools do have a student information system with an immunization reporting component, and look at those numbers now to see what the scope of the issue is.
Yeah, and I'm sorry to do the thing where you ask staff for data that you didn't ask them before the meeting. So I don't mean to put anybody on the spot. It's kind of an annoying thing. But it just occurred to me as we're watching this that maybe if we know there are places or situations where there's hundreds or thousands of students, it can help us kind of formulate an appropriate response.
Well, Richard, I think one of the main things that we are, as a response, is wanting to encourage schools to start their data entry of entering immunization records as early as possible so they can keep track of those numbers. There's a wide variety, we know, of how early people do that data entry. So some start a kindergarten roundup the year before. Some don't start their data entry until November or December. So the earlier, and Anne can speak to this, because they did a lot in the springtime with their data. If you want to share that, Anne, and the impact of that, that would be helpful.
Sure. So in Multnomah County, in the Portland School District, we have health assistants and nurses. And then in East County, we have nurses, and then the school staff, either health aides or secretaries, provide immunization support. So the models are different within the county, and we provide service to all 8 school districts here in Multnomah County. But in the spring, when things were different, right, we had an opportunity where we still had health assistants that were employed and nurses. And so we dove into Alert and ran reports and trained our health assistants on how to do data entry. And we were able to clean up all of the schools in all 8 school districts and bring as many kids up to date as possible. So that doesn't include, of course, the incoming kinders because they weren't in the system yet. But moving into the fall now, as we run our reports for the start of this school year, things are as clean as they can be. So it gives us a pretty good picture on what the gaps are in terms of kids that are still under immunized from when we stopped doing this back in June. So hopefully that will help us to get a better handle on how big is the need and where in the county is the worst situation that's out there, so that we can start to work with those communities. So it was just a good opportunity for us to do a lot of cleanup back in the spring, but not every school district has the model that we do. And in some school districts in other parts of the state, the nurse is the only person for thousands of kids and doesn't have the ability to do this. So I recognize that it does look different everywhere geographically. And And with, the shutdown and the budgetary impact of this throughout the state, who knows what staffing patterns are out there in some of these schools in terms of support staff and their availability to do this.
That's a good segue kind of into this next topic is what kind of logistically, what is it going to look like this year? I know there's going to be certain challenges with getting records. What are folks doing to plan to accommodate some of those changes? So things I'm thinking of that would be part of the discussion is, getting immunization records, working with partners like school-based health centers, things like that. So I'll open that up to folks.
I greatly appreciate that we have such a robust immunization tracking system with Alert IIS. We in my district, we will have people who normally serve kids directly, like the classroom nurses, some of the health assistants who do a lot of our secretarial jobs will be assisting with immunization tracking, monitoring this school year. So we'll be able to look kids up on Alert at home as we're sitting in our living room working all day, every day. So that's appreciated. We'll have our liaisons who are going to be able to call our families and talk with them directly. So it's not just a quick note that's sent home in a backpack. So for us, it's going to be a much more personal approach this year, especially considering that if a child is lacking a number of immunizations and it's not by family choice, then oftentimes it's that tip of the iceberg. You look underneath and you find those other social service needs that we need to address. So we'll be doing a whole lot more with that.
Suzanne, do you want me to, are you fine with me reading your comment? Yeah. So she just wanted to add that the other risk for pushing back the date is that the unintended message might be that immunizations are not really important. And if this led to a decrease in rates of immunization, it would increase a risk of disease in the future.
Sasha, sure. The question we're talking about, let me pull up my notes here, is what are you planning to do differently this school year regarding immunizations? I heard from a county that said that they were concerned about school buses. Without school buses, that's one way that they were getting immunization records from families who didn't have transportation. Sometimes they would put it on the school bus. And so they were concerned about not getting, being able to get records from families that use the school bus system as their transportation. So that was something that county was thinking through. Those are the kinds of things that we wouldn't have known at the state about how school buses are an important tool for them.
This is Sasha. I think the echo is not happening anymore. Great, thumbs up. I was just going to say that school districts are required and encouraged to, in CDL, comprehensive distance learning landscape, to provide virtual kind of, parent nights, introductions to how lessons are going to be done, introductions to virtual learning, distance learning, however that may look, online or offline in each school district. And so I'm just wondering, and kind of encouraging folks to integrate with those moments where school districts are leading with teachers and administrators real interface opportunities with parents. In those cases, they're learning about learning and how distance learning will look, but how to also embed kind of preventative health measures into that as well, and supports for immunization and information on immunizations.
Thanks, Sasha.
I'd like to
Brenna.
kind of jump off what Sasha is saying, that there are some opportunities we're seeing this year that because we are doing so much more virtual, in some ways we're increasing connections. You know, in some ways it's much harder to connect with folks, but sometimes we are able to get those connections. And just taking advantage of every opportunity, like Sasha is saying, it would be helpful for me to have things like one-pagers, infographics, just have the information condensed to be able to send that out as a blast. Here's what we can share when we're having those info sessions or meet and greets. A couple nurses I've heard from are having the opportunity to sit in on Zoom classes or to join a Zoom class and say, hi, I'm your nurse this year, just introducing themselves. So if they had that handy. I would also like to share, though, with the whole group, we're talking about differences across the state and how every community is different, and just being aware of opportunities and also challenges. For the nurses that I've been working with most closely, there was no summer break, right? Literally working days, nights, weekends, all summer trying to get things ready. And that's still going on for a lot of folks. You know, there may be some people that have less on their plates who are able to do more right now in terms of immunizations, but they're not the people I'm talking to most closely, right? They're still, like we said, a lot of students, the majority of students are not in person, but the majority of sites have some in-person stuff going on. So trying to navigate between both, reaching out to students that aren't in person and still be able to update health plans and everything else they need to do to support students, and trying to make sure that things are safe for those things that are happening on site is making people more busy instead of less. And I think I've heard from some people thinking that, you know, nurses have nothing to do because the schools are closed, and that's definitely not the case with the ones that I'm working with.
This is Donalda. I haven't heard anything about not getting immunizations, and we've been just proceeding ahead like we would normally with our Head Starts. But we have, with our distance learning, we have noticed that our family advocates have had increasing contacts with the families. You know, in about 3 months, we've logged over 17,000 contacts. So they're doing more follow-up and more interactions with the families because that's the only way we got to talk to them. So we're just continuing to proceed. I don't see us changing, and I would support not moving the dates around for the same reason others have said, because we're trying to be consistent in some things, because some things we can control and some things we cannot.
I just want to add that I think part of our messaging is just reminding people that just because COVID is here doesn't mean the other stuff goes away. Like, I think people need to hear that, because there's so much focus right now on COVID that people forget that we still might have chickenpox outbreaks and pertussis outbreaks and that type of thing. And so I think that's part of what we are trying to emphasize to our partner districts, and letting them know that we'll do everything we can to try to connect with, you know, with our health partners to try to offer. I mean, we're open to be creative, and so if partners want to, you know, tap into us to be an access point to, you know, to students and families to try to get word out on a special clinic that Ann can support and that type of thing, I think we are definitely open to that. But I think part of it is just the messaging of, you know, don't forget about this other stuff, which we have semi under control, just because of COVID happening. So, and I guess a question back to the state program too, are there going to be any resources, not necessarily financial, but, you know, are there any tools that the state can provide for us? I know back in H1N1, we did some school-based clinics. You know, is that something that the county could, assuming that we get back in person within the next couple of months, you know, provide a resource for families to try to address some of the gap. You know, just trying to be creative and innovative around addressing this issue, and knowing that this is not district's priority right now. That's the other thing we're encountering is, you know, reaching out to districts and them wanting to know, why are you asking us about health right now? When they're obviously they're trying to focus on education and trying to figure out how to do comprehensive distance learning. So, you know, recognizing that it's not necessarily number one on everybody's priority list in education, but it certainly could create a big hassle if we don't do it, if we don't get it taken care of, if we don't address it in some way.
Jamie, are you asking about state resources for giving shots?
I mean, I'm curious what might be available. You know, if the county had resources to, you know, do a parking lot clinic somewhere, you know, could they potentially tap into some of that type of thing to provide some of that outreach that right now their capacity might be limited because they're so focused on, you know, whatever county it may be, but the counties are inundated with COVID stuff too, right? So how can the counties focus on immunization while they're also trying to, you know, go through their emergency operations centers and all that type of stuff? So, you know, how can we support the counties to be a resource? How can we support providers to be a resource to think outside of the clinic walls? Because obviously, you know, when I looked at the numbers, you know, Richard brought this up earlier, when I looked at Stacy's numbers there, if I had to guess, there's probably a 4,000 to 5,000 student gap, especially in the Tdap range of kids that didn't get shots that would typically get shots, right? So, you know, where do we send those 4,000 to 5,000 kids? And my numbers might be totally off on that. You know, I haven't looked at the raw data, but you know, where do we even send those thousands of kids? Where is their capacity if we aren't creative? If we're not willing to consider, you know, school-based clinics, you know, school-based immunization clinics, in addition to student health centers or school-based health centers, in addition to pharmacies or, you know, extra resources at clinics to be able to offer a dedicated day of getting Tdap shots or whatever the focus might be. I just think that that could be something that comes up. I think we know there's a gap, but it also could be a capacity issue of how to fit it all in over the next 5-6 months.
Jamie, you're exactly on point. That is why we have the third topic of discussion. So before we move on to that, Albert, is there anything in the chat on this?
No, nothing new.
Stacy, you want to move into what are we going to do about giving shots?
Yeah, so the third question on our discussion was how can we increase vaccination in the fall and early winter to reduce the impacts of exclusions on students and the work on the part of local public health and schools. And I think that's exactly what we're looking for at this point, is that type of creativity. Like if you could dream about what we could do to increase vaccination throughout this fall, what would that look like? We already talked a little bit about making sure that we have the data to focus those resources and some of the ideas that Jamie shared. What else? What are your ideas?
I want to say again, any concise information or just sort of the package that we can pass out to people, we do have opportunities to connect. Specifically school nurses, we've had, you know, over 150 come together for various workshops over the summer, which is almost unheard of in terms of numbers, even for live events. So we're able to get information out, I think, and have people engaged more effectively in some ways. And if they have the information that they can then take and say, you know, here's the resources for our flu clinic, or, you know, here's why immunizations are so important this year, or, you know, that sort of thing that they can take back to their populations. The key, though, is not asking them to create that. I feel like, you know, not saying we might be able to do a flu shot clinic, talk with your administrators and see if that's an option, because at least, like I'm saying, the ones I'm working with are already at capacity. But if they have these opportunities to connect, and we can capitalize on that with this sort of concise information or support available.
Thank you. Yeah.
Stacy, do you want me to read out a comment on the chat, or do you want to wait?
Go ahead, Albert.
It looks like Dr. Loeffler wrote, as part of their Metro Regional Vaccine Project, a few of us checked in with our local pediatric practice consortium, and they emphasized two things. One, that they have capacity to see kids and give vaccines. And two, they need kids to also be seen in their medical homes rather than bypassing their pediatric family medicine practices to get vaccines creatively. She added, these kids and families have lots of needs.
Thank you. I think that combining some of those messages about those resources that are existing and already there and leveraging those through the communication channels that Corinna was speaking of, and not creating extra work, but just making the connection so people are able to access those resources that already exist is something that can be done.
I think there is capacity in pediatric practices to step up a bit. The most recent data I saw for Portland Metro practices was that their visit rates were still down about 70%, and for ours in Salem, it was down about 60%. So we certainly have the ability to step up and see more kids at this point.
So maybe there could be some increased messaging that goes out to let families know that in this space of CDL and staying home, that immunizations still need to happen, and that that there's not going to be a change in the immunization requirements, and encouraging people to get out there and get those shots so that they know that there's plenty of time. I mean, usually in November, we send out parent letters in multiple languages of those kids that are not up to date, but maybe the push could start now just to let them know that, yeah, this is business as usual. And there's resources out there, and this is a good time to get started rather than waiting until the last minute, because there may not be availability if you wait too long.
Thank you, Anne. Albert, are there any more comments from the chat?
Well, I'm never quite sure. They're not questions. It looks like Kimberly Bartholomew and Ann Loeffler were having an interesting kind of back and forth. But Kimberly had said, are the practices reaching out to families individually? And then Ann had responded, absolutely. They're using recall methods through alert. But having said that, this is a select group of families who are cared for in private pediatric practices.
I'm curious if anybody's heard talk or thinking about doing drive-through Tdap along with, or by itself or along with a flu clinic. Anyone heard anything about?
We haven't.
This is Ann Loeffler. I was just going to say, yeah, this group of pediatric practices, there are a few practices that are looking to do that. I think there was about 2 practices in the Portland area who were doing that early in the pandemic, but there are a couple more that are proceeding with that. But again, the concern is that these are families that have other medical needs, other mental health needs, other anticipatory guidance that's being missed by them not going to their doctors. And so it's a little bit limited.
That might be where we could partner with some of our Head Start programs. I know we didn't do immunizations, but we did oral health screenings through drive-by. And the children, stuck their head out the window and the parents drove through. It was amazing. But it worked, and people showed up and wanted to participate. So I guess, I mean, you could do drive-through immunizations as well.
This is Sasha from ODE. I also just wanted to say that health educators are our partners in this work as well. Our health education standards in Oregon focus on prevention, education, community and family involvement. And I think the more we're able to support our health teachers, the better. So if there is any sort of messaging, communication, lesson tools, activity tools that those health educators can use in their classrooms, that could be really useful as a messaging tool. And also during this time in COVID, we know that every educator is a health educator to some degree. So I would just emphasize finding opportunities to connect with teachers, educators in all avenues. So whether it's teachers conferences, other opportunities to really give them tools and education that they can then use with their students and with the families that they support. They do so much more than education. So just finding those opportunities and looping them into these conversations would be great.
Thank you. I really appreciate the discussion that's happening both orally and in the chat here. In the interest of time, I think we can go ahead and move on to the last topic on our agenda. But as you are thinking about these issues more, and if you have ideas for how we can get kids vaccinated this year, in addition to what we've discussed, please feel free to reach out to us and we will look into that. And I think we have some great action items that we can take on, starting with looking at the data and crafting some consistent messaging to get us started on this. So the last item on the agenda today, we put there a review of the criteria used to make recommendations for school and children's facility and college immunization requirements. Mallory, can you share those requirements on the screen? And we just wanted to really briefly touch on this because we've been getting questions about whether COVID vaccine is going to be required for school attendance in Oregon when the vaccine is available. And you may have been getting those questions as well. And I just want to start out with, we don't have nearly enough information to make a recommendation about this yet. This is the committee that makes recommendations to the Oregon Health Authority about implementation of Oregon's administrative rules for school and childcare and college immunization law. And this committee has adopted a set of criteria that they use to evaluate vaccines as potential requirements. The last vaccine that they actually evaluated was the meningococcal vaccine, and this committee recommended against a requirement at that time. And OHA, the Oregon Health Authority, accepted that recommendation and didn't pursue a requirement for meningococcal vaccine. We don't have a requirement for meningococcal vaccine in Oregon. I wanted to, because we have some new committee members and because this committee meets on an as needed basis, we don't necessarily always meet that often. And just a reminder of the criteria that we do use to review vaccines for potential inclusion in Oregon's school immunization requirements. And in thinking about these, we really don't know the answers to these questions for a COVID vaccine at this time. And it may be some time before we know the answers to these questions. So the committee looks at what is the effectiveness of the vaccine? What's the safety profile of the vaccine? How cost effective is the vaccine? Does the vaccine prevent substantial morbidity or mortality? And including looking at disparities in disease burden across groups, such as those living in group living, racial and ethnic disparities and geographic variation, and the potential of a vaccine to reduce the number of cases or reduce outbreaks, and how effective is the vaccine in reducing the risk of disease transmission, especially in schools or childcares or colleges. This committee looks at what the current vaccine coverage rate is, and is there a stable and adequate supply of the vaccine? And then finally, the impact on stakeholders, what funding would be needed to pay for the vaccine and the administration. What's the administrative burden on schools or children's facilities or colleges? And what's the burden of compliance for caregivers? So as you can see, for most of these questions, we don't know any of these answers for a COVID vaccine. That being said, the legislature can always make laws about vaccines that are outside of this committee's recommendations or Oregon Health Authority's recommendations. And then finally, 2 years ago, this committee did look at these criteria and make some simplifications and revisions. And in that discussion, the issue of equity was brought up. And when we were looking at, for example, this committee looked at changing a hepatitis A phase-in schedule and really looked at that discussion through an equity lens and how it would affect older students, students who are in 12th grade, for example, and graduation rates and whatnot. But we know that these criteria, equity is not specifically addressed and called out. And we would like to have a work group to look at integrating equity into these criteria, whether it's integrating into each individual criteria, making a separate criteria, or sort of the criteria as a whole, but making sure that equity is specifically called out in these criteria and it doesn't get overlooked in deliberation about recommended vaccines. So to wrap up here today, if we have any volunteers today who would like to look at these criteria and make some recommendations for integrating equity into them, that would be great. If not, it would be fantastic if you could email us if you think about this, or if you have a recommendation from someone from your organization who would be able to fill that role. So do we have any volunteers?
Stacy, this is Richard from OSBA. What kind of timeline are you talking about, and kind of what, do you have any expectation at this point? You're still kind of planning that out?
We're still working on planning that. I would say probably in the next 6 months.
I would be happy to participate in that and kind of act as a liaison between some of my school board members of color, and kind of, we have a mechanism that I think I could be helpful with, so I'll volunteer.
Wonderful, thank you.
This is Danelda. I would like to, from the migrant perspective as well.
Excellent, thank you.
Stacy, it looks like Ann Ochi and Sasha Greenier, I'm probably saying that wrong, both volunteered.
Thank you. I appreciate you all volunteering there, and we'll be reaching out to you. And like I said, if you think about this after the meeting, please send me an email if you're interested in working on this as well. And with that, I will go ahead and turn it back over to Mimi for a wrap up here.
So Stacy, this is Jenny McKibben. I was just asked by Mimi because she did have to step away to please close out the meeting. So for folks who didn't know that I was even on the call, I was the technical person behind the scenes, and I am one of the managers within the immunization program. So just wanted to say thank you for everybody's commitment today, and the discussion was really great from my perspective, and I think that's all we have. If there's any last comments from Stacy or Mallory, I think we can close.
Just want to echo thank you everyone for your participation and the discussion today.
Yes,
Thank
nicely
you,
organized. Thank you.